So I've looked at the concept of surrogate mother, surrogate mother, surrogate mother. So for this surrogate mother, we're saying it's more of like, all right, from the husband they take the egg, all right, from the wife they take the from the husband they take the sperm, okay, from the wife they take the egg. So they fertilize it in the laboratory, and then they now implant it into a different woman for the woman to help them carry it. Do you understand? So there are some ethics, there are some laws guiding this, because somebody else is helping you take your pregnancy, and later on there might be some one or two issues that might come up later on in life, especially if that child happens to be cute, or the child happens to be an achiever. Maybe the child happens to be a hustler like me, so the mother that carried that baby might want to pop back into the life of that baby and all. So it's just trying to talk about the moral, the legal aspect of this, the emotional complexities of this, all right, of one person carrying a child for another person. All right, so it's a deeply layered topic. It touches on autonomy, exploitation, parenthood, commodification of reproduction. So while surrogacy can be empowering and life-changing, it also raises serious concerns depending on how it was done, where it was done, why it was done. Okay, so for the core ethical questions, we have things like the autonomy. Is the surrogate mother fully informed to take this as only business, so that later on there's no dramas coming up? All right, those are all the questions you should be asking. Then consent. Does she understand the medical implications, emotional implications, legal implications? Does she know that this is only business and she shouldn't come up later in the future with some dramas? Okay, the co-modification. Are we treating pregnancy or children as products? Exploitation. Are surrogates, especially low income settings, being taken advantage of? Of course, because if a surrogate mother is helping you, you are basically paying her. You understand? So are you paying her in full, or you are trying to exploit her? These are all the questions you'll be asking. Okay, then parenthood. Who has the right to be called a parent? All right, and when? So all these things are basically things that you guys should explore or settle their differences right from when the pregnancy started. Right? So global perspectives. In USA, you have commercial people, like people that take this as business. All right, they are professional about it. They will never come up with issues later on. All right, UK, we have only altruistic surrogacy allowed. India, commercial surrogacy has been banned for foreigners, but the Indian population can actually indulge in it. In Australia, altruistic surrogacy is permitted. Okay, so surrogacy rights and well-being must retain bodily autonomy throughout pregnancy, should have access to mental support, needs legal protection for decisions like termination of pregnancy or medical care. Ethical contracts should include prenatal care, safeguards, and emotional support provisions, right? So commercial surrogacy just means a surrogate is paid for. Altruistic means no payment beyond expenses like taking care of the person and all of that. Okay, so this one is more of like maybe your family member offering to help carry your baby for you. Do you understand? So that's just the difference between commercial and altruistic surrogacy.